Hello everyone and welcome. Today I'm going to show you how to get rid of shoulder impingement or shoulder tightness using the Gua Sha tool. So we use this tool to break up knots that's in the fascia. These knots are known as myofascial trigger points and are tight areas within the fascia that can cause pain, discomfort, and restrict movement. There are many factors that can cause these knots, such as overuse, injury stress, and poor posture, and it could lead to a cycle of pain and muscle tightness. Fascia is a type of connective tissue found throughout the body and the surrounding muscles, bones, and organs. It's made up of collagen fibers and helps to provide structural support, maintain the body's shape, and allow for smooth movement by reducing friction between tissues. Additionally, fascia also plays an important role in transmitting force and tension throughout the body, making it an integral part of the body's musculoskeletal system. Today I'm going to work on my client who has shoulder tightness and lack of mobility in her rotator cuff area. As you can see, she has limited range of motion and her bicep cannot go past her ear. So today we're going to fix that. First, we're going to start by applying some oil or some balm on the area just to make everything go nice and smooth and it doesn't cause any friction or burning from the Gua Sha tool. Even though we're loosening up the rotator cuff muscles, you want to apply the oil upstream and downstream. So you want to apply the oil around the muscles that you're working on. So we're going to apply it also on the trapezius, down the scapula, and around to the lats. Again, this will help the Gua Sha tool move smoothly on the skin. What I like to do first is use the small end of the Gua Sha tool, and I like to work all the way up on the occipital muscles, get right up under the neck, and loosen those muscles first. Now these are light, smooth strokes that I'm using. Don't have to add a lot of pressure, and you will see some redness and you will see some red spots. Those are the adhesions that we're breaking up with the Gua Sha tool. I always got to let my clients know and warn them ahead of time what they're going to see after using this tool, because they don't really know what to expect. There's going to be a lot of redness and then some bruising can occur after a few days, but don't worry, it's temporary and it will go away. So remember, generally when you're doing this, you want to go up in one direction just to start. And on the way down the neck, I'm going to change directions and go the opposite direction. It also depends on which area you're working on. Particularly like when I'm working on the back, I like to go all four directions. So like I said, for this specific part, just up in one direction when you're doing the occipital area. So now what I'm going to do is going to work on the trapezius muscle. I'm going to start scraping. That's what the technique is called. And I'm still going to work my way up, but I'm also going to work my way down towards the rotator cuff muscle. Also remember, just be careful not to hit the spine. If you feel like you're getting too close to the spine, you can also just put your thumb there as a guide. I also like to work on the sternocleidomastoid. Yeah, try saying that 5 times straight. Sternocleidomastoid muscle, which is that muscle that's right at the front of the neck. It's that big one right in front of the neck. And if you can't find it, just get your client to twist their head to the side and it'll pop right out. As you can see, now that area is getting nice and red as you start to break down the knots in the fascia. Now it's time to start working downwards on the trapezius towards the rotator cuff muscles, around the scapula, and down to the lats. I find when I'm working on the lat area, it's easier to have my client put their hand on their opposite shoulder to stretch out the lats. That way you can get nice and deep into that tissue. The lats is a very big muscle. So if you stretch it out, you can get better scraping. So as you see, the red is now moving up to the surface. That's the blood. So what you want to focus on is the red circles or knots. If you see those, pay more attention to those and spend more time on those areas. I also like to add a little bit of massage as a treatment for the myofascial trigger points, because that's another therapy that helps release the tension and restore normal tissue mobility. As you can see now, my client's range of motion has increased and the bicep can go past the ear, and it can move a little bit more freely now. Also, my client could bring her arm across her body and feel no tightness as she stretches across her body to the opposite shoulder. So just remember, there's going to be some redness on the neck and the shoulder area and the back, and you're going to see those red dots, and those are the ones that you want to focus on. So just remember, there's going to be some light bruising, but that's normal. That's just part of the healing process. If you're looking for a good Gua Sha tool, I'll leave the description below, and don't forget to hit that notification button and hit that thumbs up.